Hello everyone. In this session, we are going to discuss the ultra important topic that is benign versus malignant tumors. So you have to differentiate the benign tumors and the malignant tumors based on 5 important properties. Usually, you can get a long question on that. So you have to differentiate the benign versus malignant tumors with 5 properties with proper diagrams and everything. And sometimes you can get a short question on any of the one property or feature of anaplasia. So let's start it. So you can see here we are starting the topic that is benign versus malignant tumors. So let's start benign versus malignant tumors. So we have to differentiate the benign tumors from the malignant tumors based on the 5 features. First of all, we will differentiate them based on their rate of growth. Then we will differentiate them based on their clinical features. Then we will differentiate them based on their gross and microscopic features one by one. In the microscopic feature, we will see the anaplasia, the 10 features of anaplasia. So anaplasia is a hallmark of malignancy. All the anaplasia features are absent in benign tumors and they are present in malignant tumors. So we have to see what is anaplasia and what are the 10 features of anaplasia and how it is used to differentiate the benign tumors from malignant tumors. And finally, the last one, the most important one, which is used to differentiate the benign versus malignant tumors is spread of the tumors. So one by one, we will differentiate the benign tumors from malignant tumors based on these 5 features. They are in front of you. So let's start it. So first of all, we are starting with the first feature that is rate of growth. Based on rate of growth, how we differentiate the benign tumor from the malignant tumor. Benign tumor are slow growing and the malignant tumor are very fast growing. That is the meaning of the rate of growth. So whenever any patient is coming complaining of a lesion or a mass anywhere in any part of the body, the first thing is its rate of growth. I mean, is it a slow growing mass or it's a fast growing mass? So that will give a guess or an idea, is it benign or is it malignant? Exceptions are always there, but it will give you a rough idea, rough guess that is it benign or is it malignant. Benign tumors are slow growing. They have less mitotic rate. That's why they are very slow growing. And the malignant tumors are very fast growing because they have high mitotic rate. They have high mitotic rate. That's why they are very fast growing. Now, please understand a concept here that is doubling time. What do you mean by doubling time? For example, here there is a mass, there is a tumor that is 1 centimeter in diameter. Now, from 1 centimeter, what is the time required for this tumor to become 2 centimeter? And what is the time required by this tumor to become the 4 centimeter? So what is the time required by the tumor to become double in size? That is known as doubling time. Now I told you benign tumors are very slow growing. So here doubling time is very high because they are very slow growing now. So they require years and years sometime to get doubled, maybe many months or years. But I told you the malignant tumors are very fast growing. So here doubling time is very less. Very quickly, within few days or few weeks, they just double. They keep on doubling. So benign tumors, the doubling time is more because they are slow growing. They require more time to get doubled. And malignant tumors, they are very quick. They are very fast growing. They have high mitotic rate. So within few days, they become doubled. So here doubling time is less. So you have to understand the benign tumors versus malignant tumors based on rate of growth. That is the first feature. Now, the second feature is the clinical features. Based on the clinical features, how we can differentiate the benign tumors from malignant tumors? Benign tumors are slow growing and usually asymptomatic. I am saying the word usually. Exceptions are there. And malignant tumors are rapidly growing and usually they are symptomatic. For example, they can ulcerate, they can invade, they can show the metastasis, but exceptions are there. Now, let me tell you one exception. I told you most of the benign tumors, they are asymptomatic. Now, consider meningioma. You can see meningioma is a benign tumor of the meninges of the central nervous system. So, but sometimes it can produce seizure. It can be horrible in presentation. So, it is not always that all benign tumors are asymptomatic. Sometimes they may produce the symptom, the serious symptoms. And in the similar way, I told you malignant tumors are usually symptomatic. They can ulcerate, they can invade. But for example, consider breast cancer. Breast cancer at initial stage, it's absolutely asymptomatic. No pain, nothing. So, sometimes it is exception is there. So usually the benign tumors are asymptomatic, but exceptions are there. And usually the malignant tumors are symptomatic, but exceptions are there. That is the summary. Now coming on the third feature is the gross. Based on the gross, how we differentiate the benign tumors from the malignant tumors based on the gross. So how we can differentiate? Benign tumors are spherical and well encapsulated. Malignant tumors are irregular and no capsule is there. Can you see here? Now both of them, you can see the two images here. Both of them are tumors of the breast. This is a benign tumor of the breast, that is fibroadenoma. And you can see this is the malignant tumor of the breast, that is invasive ductal carcinoma of the breast. Now you can see here the tumor is, let me show you the boundaries here. You can see here the tumor is spherical, oval or spherical in shape. And you can see here the tumor is irregular in shape. Now appreciate. Here the benign tumor is well encapsulated. This one is well encapsulated. You can appreciate here. And this one is non-encapsulated. This one is freely mobile. This one becomes fixed. So you can appreciate grossly. Looking at the gross, you can guess. So you can see again the same diagram. This is the benign tumor. You can appreciate. And this is the malignant tumor. The benign tumor are spherical, oval, well encapsulated. The malignant tumors are irregular in shape. They don't have any capsule and they are fixed. So you can see this is spherical, this is irregular. This is encapsulated, no capsule is there. Now the benign tumor compress the surrounding tissue and malignant tumor invade the surrounding tissue. What do you mean by that? What do you mean by that? Compression means pushing. The benign tumor is pushing the adjacent tissue and producing symptoms. It is pushing the adjacent tissue and producing the symptoms. But malignant tumor don't push, it invade. It invade inside the tissue. It don't push, it just penetrate. Invasion means penetration. It will penetrate inside the tissue and produce the symptom. So benign tumor push, that is compress the surrounding tissue. But malignant tumor penetrate, that is invade the surrounding tissue. So that is the gross. After that, coming on the fourth feature, that is microscopic. So let's revise the first three. So what we are doing, we are differentiating the benign tumor from the malignant tumor. We have to differentiate based on 5 features, 5 properties. So out of them, 3 are done. The first is based on their growth rate. The first feature is based on their growth rate. We have to differentiate them. Second, based on their clinical features, we have to differentiate them. And third, based on their gross, we have to differentiate them. Followed by microscopy and spread, I will tell you. So based on the growth rate, the benign tumors are slow growing. The malignant tumors are rapid growing or fast growing. Here the mitotic rate is very high. Here mitotic rate is very low. Since here mitotic rate is very high, the doubling time is less. The doubling time is less. It requires high time to get doubled. And here since mitosis, I'm sorry, I just said the reverse. Here you can see benign tumors have low mitosis, very low mitotic. They're slow growing now. That's why doubling time is very high. It requires years to get doubled. Okay. And here in malignant tumors, the mitosis is very high. They go on dividing, they keep on dividing. That's why here the doubling time is less. Here the doubling time is very less. So based on the growth rate, this is how we can differentiate them. Now coming on the clinical features, benign tumors are usually asymptomatic, but exceptions are there. And malignant tumors are usually symptomatic, but again exceptions are there. Now coming on the gross findings, in the gross you can see benign tumors are spherical in shape or oval in shape. The malignant tumors are irregular in shape. Okay, the benign tumors are well encapsulated. Here capsule is present and these are poorly encapsulated. Here capsule is absent. Okay, benign tumor compress the surrounding tissue and malignant tumor invade, that is penetrate in the surrounding tissue. So please learn the differences by heart. Now coming on the fourth feature, based on the microscopy, the most important one. Based on the microscopy, how to differentiate them. Now there is a term you have to understand here. The name of the term is anaplasia. Anaplasia is a hallmark of malignancy. Anaplasia is present in malignant tumors, not in benign tumors. You will say, ma'am, what is anaplasia? I don't know what is anaplasia. Please explain. So anaplasia is lack of differentiation. You may be thinking, ma'am, what is differentiation? First understand what is differentiation, then see the lack of differentiation is anaplasia. And please understand anaplasia is absent in benign tumors, present in malignant tumors. Anaplasia is the hallmark of malignancy. So please understand what is differentiation. Here you can see there is a tissue. Can you see? Yes, this is a tissue. In this tissue, you can see this is the tumor cells. Can you see? And the remaining one are the normal cells. Now see the tumor cells. The tumor cells, these all blue cells. You can see these all are tumor cells, and you can see these all are normal cells of that tissue. Whatever tissue it is, it can be any tissue from head to toe in human body. Now the tumor can occur in any of the tissue. You can see these are the normal cells. These are the normal cells, and you can see these are the tumor cells or the cancer cell in that particular tissue. Now you have to say that cancer cell or tumor cell, how much resemblance of the cancer cell or tumor cell is there as that of normal cell. That percentage of resemblance is known as differentiation. So tumor cell, up to what extent the tumor cell is morphologically or functionally, it is looking like the normal cell, or is it completely different? So you have to tell me the extent of resemblance between the cancer cell and the normal cell, the percentage of resemblance. So that is known as differentiation, and lack of differentiation is known as anaplasia. What is anaplasia? Lack of differentiation. So basically the tumor cell are completely different from that of surrounding tissue, from that of the normal cell. There is no resemblance at all. That is known as anaplasia. So anaplasia occurs in malignancy. It's a hallmark of malignancy, and it's always irreversible. You say, ma'am, how I will come to know that whether a particular tumor is having anaplasia or don't have any anaplasia? For example, a patient is coming to my clinic. The complaint of the patient, she is a female patient and she is feeling a mass in her breast since last few days. So this is the breast, and inside the one of the breast, she is feeling a mass. She is feeling a nodularity. She is feeling a mass in her breast. Now it can be a benign tumor. It can be a malignant tumor. I don't know. So what to do? Do biopsy. The first thing you have to do the biopsy. On the biopsy, look in the microscope the features of anaplasia. If the features of anaplasia are absent, it's a benign tumor. If the features of anaplasia are present, it's a malignant tumor. And whatever the tumor is, based on that, decide the further course. If it's a benign tumor, you can just do the surgery. That's it. If it's a malignant tumor, after surgery, you have to give chemo also and radio also. And you have to give targeted therapy, hormonal therapy. So that will be the different courses. So benign tumors versus malignant tumor. You may be thinking, ma'am, why it is necessary to differentiate benign tumor versus malignant tumor? Is it necessary? Both of them present as a mass at any part of the body. Why it is necessary? Being a doctor, why it is necessary to differentiate benign from malignant? Because treatment of both of them is different. This require only surgery. That's it. This after surgery or before surgery, it requires chemo also and radio also, sometimes targeted therapy, sometimes hormonal therapy, various therapy. And what about the second thing, prognosis? Here prognosis is good. I mean no recurrence. It never recur. Here the prognosis may be poor sometime depending on what stage we are doing the diagnosis, and here recurrences are common. So that is why we have to differentiate whether the tumor is benign or malignant. It is not the thing the patient is coming with a mass, you have to operate it, that's it. No. First do a biopsy, become sure whether the tumor is benign or malignant. Based on that, tell the further treatment to the patient, consult the patient and tell the prognosis to the patient based on that. So if any lady is coming to me having a breast nodularity, the first thing I will do is the biopsy. Based on the biopsy, I will decide whether the tumor is benign or malignant, and based on which I will tell the proper treatment and the prognosis to that patient. So in the biopsy, what I will look for? I will look for features of anaplasia, whether anaplasia is present or absent. You will see, ma'am, how to see anaplasia? Anaplasia is seen microscopically only. So for anaplasia, you require a slide. It has to be seen microscopically. Okay, it is not seen grossly. In the microscopy, you will see anaplasia is present or absent. So if any mass is present, take the biopsy and make a slide. And on slide, look for these 10 features. If all the 10 features are absent, it's a benign. And if all the 10 features are present, it's malignant. So anaplasia is the hallmark of malignancy. Got my point? These are the 10 features that defines anaplasia. These are the 10 features that define anaplasia. They all are absent in benign tumor and they all are present in malignant tumor. So in short, I will explain all one by one. So in short, we can say anaplasia is absent in benign and anaplasia is a hallmark of malignancy. Okay, now what are the 10 features? One by one, we will look at them. So we will look all the 10 features. You can count all the 10 features in these two diagrams. You can see here, the diagram is showing normal. And here the diagram is showing anaplasia. We will differentiate them based on this diagram. The first feature is loss of polarity. Let's start it. What is loss of polarity? What do you mean by loss of polarity? Now you can see this is a normal tissue. See the cells. And this is the anaplastic tissue. See the cells. Can you see the cell? Let me mark. This is a cell. This is a cell. Okay, let me draw it on another page. Now here I am drawing the normal. Here I am trying to draw the normal and here I will draw the anaplasia. Okay, in the normal, these are the cells. I am trying to draw the cells, the epithelial cells here. And here I am trying to draw the anaplastic cells. Here I am trying to draw the anaplastic cells. Okay, like this. Okay, now see, this is basement membrane. We have a basement membrane here and we have a basement membrane here. Where is the nucleus? Nucleus is never in the center normally. Normally the nucleus is towards the basement membrane. You can see it's not in the center, it's towards the basement membrane. This is normal. Can you see? This is normal. So normally basal polarity is present. It is known as basal polarity. So normally basal polarity. What do you mean by basal polarity? So nucleus is towards the basement membrane. The pole, there is a north pole, south pole, that is the polarity. So the polarity of the nucleus is towards basement membrane. So basal polarity is present here. Normally it's present, but in anaplasia, the nucleus is big in size and it is away from the basement membrane. It is not towards the basement membrane. It's away from the basement membrane. Can you see here? Now see the difference. This is anaplasia. So can I say here the basal polarity is absent? Absolutely. Here the basal polarity is absent. So you can see and you can differentiate. This is normal or benign, and this is anaplasia or malignant. So in anaplasia, the basal polarity is lost. So first thing, if I'm having a slide, I will look whether the basal polarity is present or absent. If the basal polarity is maintained, I will say it's a benign tumor. And if the basal polarity is lost, I will say it's a malignant tumor. This is how we differentiate based on the basal polarity. You got my point? The location of the nucleus inside the cell. The same you can appreciate here. Now see the nucleus here? It's towards the basement membrane. See the nucleus here? It's towards the basement membrane. See the nucleus here? It's towards the basement membrane. On the contrary, see the nucleus in the anaplasia. You can see the nucleus. Here the nucleus is away from the basement membrane. Nucleus is away. So you can better appreciate the diagram which I have drawn. So here basal polarity is retained and here basal polarity is lost. So the first feature is basal polarity. Express in your own words. Don't try to mug up. So what is basal polarity? Normally the nucleus is present along the basement membrane. But whenever the tumor cell lose the basal polarity, that is nucleus tend to lie away from the basement membrane. So in anaplasia, the basal polarity is lost. The next feature here is the pleomorphism. The second feature is the pleomorphism. Here you can see all the cells are same shape, same size. Here some cells are small, some are normal, some are large. So variation in size of the cell. So normally pleomorphism is absent and here pleomorphism is present. Here in anaplasia, pleomorphism is present. Pleomorphism is variation in size. Where you can see, here I can't see variation in size. They all are same size, uniform. So here pleomorphism is absent. But here I can see some cells are small, some are normal, some are large. So variation in size is there. That is pleomorphism. So presence of pleomorphism is a feature of anaplasia. So in anaplasia, till now we have seen two properties. The basal polarity is lost and pleomorphism is present. So basal polarity, it's lost and pleomorphism, it's present. So that is the second thing we have seen. We have seen basal polarity, it's lost here, and pleomorphism, it's present. Pleomorphism is variation in shape and size of the tumor cell. So variation, some tumor cells are small, some are big, some are large, some are normal. So here pleomorphism is present. The third feature, I have to teach you 10 features. The third feature is the ANSI ratio. What is ANSI ratio? Nucleus cytoplasmic ratio. What do you mean by that? I will draw. So let me draw a cell which is normal. And let me draw a cell which is anaplastic. Anaplastic cell is little bit larger than the normal maybe. But sometimes it can be same size. And here this is the nucleus. Now see the nucleus normally. And here this is the nucleus. See the nucleus in the anaplastic cell. Let me draw and highlight the nucleus in the anaplastic cell. You can see this one is normal. And you can see this is anaplasia. Okay, now consider ANSI ratio here, nucleus upon cytoplasm. Consider ANSI ratio here, nucleus upon cytoplasm. The size of the nucleus upon size of cytoplasm. So see, what is the size of the nucleus here? Nucleus is small, but cytoplasm is big in size. And here the reverse is happening. Here, the nucleus is big relatively as compared to normal. And cytoplasm is relatively same or little bit larger. So here the numerator is more as compared to denominator. So you know here ANSI ratio is more. Here ANSI ratio is normal or less, and here ANSI ratio is more. You can appreciate the numerator. You can see the nucleus here. That is the numerator, and you can see the nucleus here. Compare the nucleus. So you will get the ANSI ratio. Here ANSI ratio is normal. Here ANSI ratio is high. So high ANSI ratio is a feature of anaplasia. It's a feature of anaplasia. So in anaplasia, the ANSI ratio is more because the nucleus is enlarged, disproportionate to that of cell. So in normal cell, the ANSI ratio is 1:4. But in anaplastic cell, it's 1:1. It's 1:1. Okay. Now the next thing is the anisonucleosis. What is anisonucleosis? It's looking complicated. Whenever in pathology, anything is complicated now, split the term. The basic funda, split the term, you will get the meaning. So anisonucleosis. Anisonucleosis. What do you mean by that? Anisonucleosis, it's a complicated term. An means no. Iso means is equal to. Nucleosis means nucleus size, the size of nucleus. the nucleus size, no equal size of nucleus. So here you see, now see the normal diagram. Here you can see all the cells are, all the nucleus are same, uniform. So here all the nucleus are same or uniform normally. But here you can see some nucleus are small, some are large, some are normal. So variation in size of the nucleus is the feature of anaplasia. So here anisonucleosis is absent and here anisonucleosis is present. That is variation in size. No equal size of the nucleus is the feature of anaplasia. So that is anisonucleosis. Nucleus show variation in shape and size in anaplasia. So till now I taught you 4 features. What are the 4 features? What are the 4 features? You tell me basal polarity. After basal polarity, I taught you pleomorphism. After pleomorphism, we have seen ANSI ratio. And after that, we have seen Anisonucleosis. You tell me benign and malignant. So what is the difference between how we differentiate benign tumor from malignant tumor based on this? How we can differentiate? Here basal polarity is retained, but in malignant tumor it is lost. Here pleomorphism is absent, here it is present. Here ANSI ratio is less, here ANSI ratio is high. Here anisonucleosis is absent, here it is present. So till now, out of the 10, we have seen 4 features of anaplasia. So that is present in malignant tumors. Okay, now coming on the 5th feature. The 5th feature is the hyperchromatism. The 5th, 6th, 7th and 8th. These are the 4 features of the nucleus. Now see the color of the nucleus. See the nucleoli inside the nucleus. See the mitosis in the nucleus and see the number of the nucleus. So number of nucleus, color of nucleus, mitosis in the nucleus and nucleoli in the nucleus. So we will see these 4 features for the nucleus. So first is hyperchromatism. You know what is chroma? What do you mean by the term chroma? Chroma means color. Chroma means color. Now see the color of nucleus in both of them. You can see here the color of the nucleus is relatively normal. But here in anaplasia, the nucleus become compact, the chromatin become compact. So nucleus become dark, more dark in color. It is known as hyper. Hyper means more. Chroma means color, dark color, chromatism. So hyperchromatism means dark color nucleus. So hyperchromatism is seen. Nucleoli inside the nucleus. Here I can't find any nucleoli inside the nucleus. No, I can't find any nucleoli. But here inside the nucleus, we can find multiple dot. That is the nucleoli. So nucleoli are present. Prominent nucleoli are present in malignant tumors. Now see the mitosis. Normally we can't find any mitosis here. See in this diagram. I can't find any mitosis. And if I find also, that will be typical. But here, can you see here? I can see the spindle. Appreciate the spindles over here. Can you appreciate the spindles here? Spindle formation. That's the abnormal mitosis I can see. Abnormal mitosis is a feature of anaplasia or malignancy. Abnormal mitosis is there. Now see the giant cells. I mean here, one cell, one nucleus. One cell, one nucleus. Here in few cells, multiple nucleus are there. So such a cell with multiple nucleus is giant cell. So again, giant cell is a feature of anaplasia. And now finally see the cytoplasm, the color of the cytoplasm. Here all the cytoplasm is pink in color. Sometimes here cytoplasm is little bit bluish in color because of the mucin. So sometimes mucin is there in the cytoplasm. And lastly, aneuploidy. If you see the genetics, all the cells are diploid here normally. And here aneuploidy is common. Aneuploidy is common in malignancy. So these are the 10 features you have to learn. These are the features of anaplasia. Can you please enumerate? Help me to differentiate benign versus malignant tumors. What we have learned till now. So let me revise you. Let me help to revise you what we have learned till now. Please everyone here on the screen. So I told you we have to differentiate benign tumors from malignant tumors based on 5 features. This is the 4th one going on. That is anaplasia. So the first I taught you based on the growth rate. Differentiate benign from malignant. Okay, the first feature based on the growth rate. The second I taught you based on the clinical features, differentiate them. The third based on the gross. And the 4th one, which is I'm teaching you right now, is the microscopy. Based on microscopy, that is anaplasia. Microscopy. Anaplasia. In the microscopy, it is known as anaplasia. Okay, anaplasia. Look for anaplasia. And finally, last one I will teach you. So this is the 4th based on 1, 2, 3, 4. In the fourth one, there are 10 features. You have to enumerate those 10 and differentiate the benign versus malignant. Got it? So based on the growth rate, benign tumors are slow growing, having low mitosis and high doubling time. The malignant tumors are fast growing, having high mitosis but low doubling time. I know you can understand, I guess. Now coming on the clinical features. Clinical features, these are usually asymptomatic, but exceptions are there. These are usually symptomatic, but exceptions are there. And I told you the exceptions also. Now coming on the gross, in the gross, we have seen these are spherical in shape and capsule is present and they compress the surrounding tissue. These are irregular in shape, capsule is absent, they are not capsulated. And here they invade the surrounding tissue. Now coming on the microscopy, you have to enumerate the 10 features. What are the 10 features? The first is basal polarity. The first feature is the basal polarity, based on which differentiate the two. The second is the pleomorphism. Basal polarity, pleomorphism, ANSI ratio. The third one is the ANSI ratio. Then we have Anisonucleosis. Then hyperchromatism or nucleus color. Hyperchromatism or chromatism of the nucleus. Then nucleoli. Then giant cell. Then mitosis. Okay, and then cytoplasm and aneuploidy. These are the 10 features. So here basal polarity is retained. Here basal polarity is lost in anaplasia. Pleomorphism is absent here, but it is a feature of anaplasia. ANSI ratio is low here. ANSI ratio is high in anaplasia or malignancy. Anisonucleosis is absent here, but it is present in malignancy. Chromatism, here the nucleus is normal color and here nucleus is dark. That's why hyperchromatism. Here nucleoli are not present. Mitosis is not present normally. You can see nucleoli and mitosis is not present here. But here you can see the nucleoli are prominent here. Just a second. The nucleus is prominent here. Just a second. Okay, that page is gone. So we can revise it, okay, anyways. So that is based on these 10 features, we can differentiate the benign versus malignant tumor. In the end, we will revise it again. Okay, these are the 10 features. I want you, rather learning the 10 features, draw them in a diagram. Try to draw all 10 features in one diagram. Try to show them in one diagram, or you can draw multiple diagrams also and show them. Now, for example, if a female is coming to us and female is complaining of irregular menstruation, we are doing a radiological imaging, and on sonography or imaging, we found there is a mass in the uterus. Okay, in the myometrium of the uterus, you can see there is a mass or there is a mass. One of the two possibilities there. Okay, now based on that, what we can decide. So looking at the gross, here you can see this one is spherical in shape. It's well circumscribed. It is pushing the tissue, compressing the tissue, surrounding tissue. This one is irregular. Okay, and it is invading the surrounding tissue and no capsule is present. So based on the cross, this is benign, this is malignant. Now it's a gas. We cannot say it confirmatorily. So for that, we have to make a slide here. We have to make a slide. Do the biopsy or do the surgery and make a slide. Now this is the slide of benign. This is the slide of malignant. Whatever 10 features I told you, basal polarity, pleomorphism, ANSI ratio, anisonucleosis, mitosis, whatever, apply all 10. All 10 are absent here. All 10 are present here. So anaplasia is absent in benign and anaplasia is present in malignant. So based on which we will decide the treatment and further course for this. So any organ can have benign tumor, the same organ can have malignant tumor also. But treatment will be different, prognosis will be different. That is the summary. Got it? So we have differentiated benign versus malignant tumors till now based on 4 features. Based on rate of growth, based on clinical feature, based on gross, and the microscopy is anaplasia. So based on microscopy or anaplasia also we have differentiated. Now finally the 5th and the last feature, the most important, spread of tumor. There are 2 types of spread of tumor. There are 2 types of spread of tumor, local spread and distant spread. Distant spread is known as metastasis. What do you mean by that? For example, this is a person and let's say this person is having any malignant tumor. For example, let's say this person is having a tumor of the stomach. Let me draw it. So for example, this is the GIT of this person. You can see this is the intestine. Okay, and these are the other organs I'm drawing here. Okay, multiple organs are there, just other organs. Now, just suppose this person is having a tumor or malignancy in the stomach. Okay, now this is a tumor. Now, this is a malignant tumor. What will happen? This is a malignant tumor. Now, so it will invade the same tissue, invade. In continuity, it will expand and involve the adjacent organs. The adjacent organ can be spleen, pancreas, liver, it can be intestine. But the thing is that it's in continuity. It is in continuously. It is involving the adjacent organ. It is known as local invasion. This one is locally invading. Local invasion. Local invasion means tumor is invading the corresponding organs, multiple adjacent organs, but in continuity. Now, after that, what will happen? After that, this is the blood vessel. Let me draw a blood vessel. This is a blood vessel. Some of the tumor cells will enter inside the blood, and from blood or lymphatic, it will spread to multiple organs, and it will form multiple secondaries and multiple other organs which are discontinuous from the primary. You can see the primary tumor is here, but multiple secondaries are formed which are discontinuous from the primary. The primary tumor is spreading via the blood or the lymphatic. So this multiple secondaries is known as metastasis. That is distant spread. Here the secondary tumors are discontinuous from the primary, but here in local invasion it is in continuity. I hope you got it. Now both these features, the local invasion and the distant invasion, that is metastasis, both of them are absent in benign and both of them are present in malignant. Mind my words very carefully. Both of them are absent in benign. Benign tumor neither show local invasion nor show metastasis. Malignant tumor show local invasion as well as metastasis. Please learn them by heart and understand it. So I hope you are getting it. You can see this is the tumor. You can see the blue color is the normal tissue and you can see the red color is the tumor. This is a red tumor inside a blue tissue. Okay. Now first it will locally invade, then it will go in the blood. Can you see this is the blood vessel? Some of the tumor cells are dropped in the blood and via blood it is spreading. It is spreading and going out. It is spreading via blood, spreading and going out, extravasation in some other organ where it is growing and showing multiple secondaries which are discontinuous. So both the features, the local invasion as well as metastasis. Benign tumor neither show local invasion nor show metastasis. Malignant tumor show local invasion as well as metastasis. Got it? Now there are 5 features based on which we can differentiate the benign tumor from malignant tumor, as I told you. Okay. Now which is the most reliable feature? We can differentiate them based on their rate of growth. We can differentiate them based on the clinical feature. We can differentiate them based on the gross, based on microscopy, that is anaplasia. The 10 features of anaplasia, and based on the spread. In the spread also there are 2 properties, the local invasion and metastasis. What is the most reliable feature? I told you in the spread the 2 things, both of them are absent in benign and both of them are present in malignant. Local invasion as well as metastasis, both of them are absent in benign and both of them are present in malignant. I'm asking which is most reliable. So answer is most reliable is metastasis. If metastasis is present, it has to be malignant. There is no other choice. Rest all are, we are guessing. Now I'm saying you the benign tumor are slow growing and the malignant tumor are fast growing, but exceptions are there. If I'm saying you clinical feature, benign tumors are asymptomatic, malignant are symptomatic, but again exceptions are there. Based on the gross, I'm telling you these are oval, spherical in shape and they have the capsule. They are irregular in shape. They don't, but again exceptions are there. Anaplasia is gray zone. Sometimes it is not always that you all the 10 features are absent here, all the 10 features are present here, but sometimes you get the gray zone. But if metastasis is present, it has to be malignant. So most reliable among all the most reliable feature is metastasis. The second most reliable is the direct local invasion. So most reliable and second most reliable feature which is differentiating the benign and the malignant is the spread of tumors. So metastasis is the most reliable feature which differentiate the benign versus malignant, and local invasion is the second most reliable feature which differentiate the benign versus malignant, and after that the third reliable is anaplasia. And here these are not reliable features, but based on which we can differentiate benign versus malignant. I hope the concept is crystal clear. Based on these 5 features, differentiate the benign versus malignant. Make this table. So make this table. So you tell me benign tumor versus malignant tumor. See the clinical features and gross we have taken together. The benign tumors are well encapsulated. The malignant are non-capsulated. The benign tumor compress the surrounding tissue. The malignant tumor invade the surrounding tissue. The benign tumors are small in size. They grow slowly. The malignant tumor are fast growing. They are large in size. Here secondary features are absent. Here usually present. All the 10 features of anaplasia. You know all the 10 features. You please enumerate: basal polarity, pleomorphism, NC ratio, anisonucleosis, hyperchromatism, mitosis, giant cell, chromosomal abnormality. They all are absent in benign and they all are present in malignant. You can see they are absent in benign, present in malignant. Growth rate: benign tumors are slow growing, malignant are rapidly growing. Local invasion and metastasis both are absent in benign and both are present in malignancy. Prognosis wise, benign tumor have less complications, so prognosis is good, but malignant tumor have more complications, so prognosis is poor. So we have differentiated benign versus malignant tumor based on these 5 features. So please write down of your own the differences between benign versus malignant tumor here, like this. So can we revise it quickly? Based on the rate of growth, these are slow growing, having low mitotic rate and high doubling time. These are fast growing, having high mitotic rate and low doubling time. Coming on the clinical features, based on the clinical features, these are usually asymptomatic, exceptions are there. These are usually symptomatic, exceptions are there. Coming on the gross finding, grossly these are oval in shape, spherical in shape, and capsule is present. Here they are irregular in shape and capsule is not present. They compress the surrounding tissue, they invade the surrounding tissue. Now all these 10 features of anaplasia, they are absent in benign. All 10 are absent in benign and all 10 are present in malignant. Please learn them by heart rather than learning. Try to show them in diagram in your university exam. Well labeled, beautiful diagram, and write down in your own words all 10. You have to express in your own words. And finally, the spread of the tumor. There are two types of spread. There are two types of spread of the tumors. Let me show you here the two types of the spread of the tumors. Both the spread of the tumors, just a second. So both the spread of the tumors here, you can see the local and the metastatic. They are absent in benign and they are present in malignant. Among all these features, the most reliable feature, let me tell you the most reliable feature. The most reliable feature is the metastasis. And second most reliable feature is the local invasion. I tried my best to explain you the differences between benign versus malignant tumor. Please do check the long question, short question, very short question and MCQs on this topic in your notes section and question bank. And you get all these type of questions on this topic. It's a very important topic. Thank you so much. I hope you got it.